So we have about half of the Global Commission, the overall membership here today. A number of them are going to speak. I'm going to hand this over first to the incoming chairperson, the chairman of the Global Commission on Drug Policy, and the former president of Switzerland, Ruth Dreyfus.
Thank you, Ethan. Thank you to all of you to be here at our invitation. Thank you for the media people who are so important for outreaching new ideas. Thank you also for the members of the NGOs I see in the room. I think our room is more welcoming than some of the rooms of the UN building. So I am delighted to see you here. The Global Commission on Drug Policy deserves some words of presentation. It is a self-constituted club of people who felt that it is their responsibility to provoke a discussion, a large debate on drug policy in the world, and to use their capacity as former head of states, former head of government, responsible in the economic life, in the cultural life, to avert the governments, the agencies of the UN family, and so on, about the need of reform. You have the list of the members in the red report. I think in the red report, one member is missing, and that's Nick Clegg that joined us after changes in political life in the UK. We are working as advocate for change through reports. This is one of 5, and we are preparing others, with visits to government responsible, with also working very strongly with NGOs to promote all what is growing on the ground toward reforms of failed drug policy. So you will find here our position, and you will see that we were not expecting a lot from UNGASS, and in this sense, our prevision was what the reality is. That is that the world community is not ready, is not willing to have the change of paradigm that is absolutely necessary. This change of paradigm will be explained by my colleagues here, and we will be open and delighted to answer your questions.
Thank you very much, President Dreyfus. So when the commission was created 6 years ago, it was mostly former presidents and prime ministers and other distinguished officials, but one businessman joined the commission and has played a pivotal role, and that is, of course, Richard Branson. Richard?
Thank you. Well, the UNGASS declaration agreed this week. It's long on rhetoric, and it's very, very short on substance. And many key issues are missing. It does not call for an end to criminalization and incarceration and capital punishment for drug-related offenses. It fails to request the World Health Organization to review drug scheduling. It does not explain how to ensure treatment for users and says nothing about regulation. The UNGASS declaration is out of step with mounting evidence and with public sentiment. Rather than offer practical solutions based on science, it doubles down on the status quo. It comprehensively fails to acknowledge the many harm reduction and regulatory innovations, many of them successful, taking place around the world. It just does not go nearly far enough. Part of the reason UNGASS failed to deliver is because the process was fatally flawed from the beginning. Let me explain. In the lead up to UNGASS in 2015, the Commission on Narcotic Drugs, or C&D as they're known, held preparatory meetings with its 53 members. Many states who sit on the C&D, China, Iran, Russia, favor repressive approaches to drug policy. The first mistake is that the C&D should not have been allowed to lead the process. The members of the C&D were supposed to draft a declaration that would represent the interests and realities of all 193 member states. But the drafting process was obscure and tightly controlled by a self-appointed UNGASS board. Inputs from non-members of the CND were by and large rejected. Substantive concerns were completely ignored. When the draft UNGASS declaration was completed on the 23rd of March 2016, it was far from representative. The second mistake is that the process should have been much, much more inclusive and representative. The negotiations in the lead-up to UNGASS throughout 2015 and the first 3 months of 2016 were neither transparent nor inclusive. The inputs of key UN agencies working on health, gender, human rights and development, along with 2/3 of all UN member states, were excluded. A third mistake is that the UN Office on Drugs and Crime was put in charge and perpetuated a hardline criminal justice approach. During the preparations for UNGASS, nearly 200 civil society organizations from around the world were literally shut out of decisive meetings. Their views and inputs were sidelined. What is more, on the day that UNGASS opened on the 19th of April, many NGOs were denied entry to the UN on the grounds of security risks, in open inverted commas. Even materials they were carrying were confiscated by UN security. The fourth mistake is that UNGASS itself excluded the voice of civil society. It was unable to accommodate the desire for change. UNGASS is a missed opportunity. The UNGASS Declaration does not acknowledge the existence of many new and urgent drug-related threats facing the world. It reaffirms the 2009 political declaration claiming tangible progress, but there are no clear indicators measuring what the progress is. Illicit drug markets continue flourishing. Money laundering is rife, as the Panama Papers amply show. None of these issues are addressed in the UNGASS Declaration. The problem is that UNGASS is out of step with realities on the ground. As more and more national, state and municipal governments pursue progressive approaches, including regulation, the more they will show the inherent flaws of the international drug control regime. The risk is that the UN, and in particular the CND, fails to adapt to changing priorities, realities and evidence, and that the multilateral approach to controlling drugs collapses altogether. It may already be too late to save the broken and fragmented drug regime. The bad news is that UNGASS Declaration perpetuates a damaging status quo. The good news is that UNGASS is just one milestone on the road to transforming drug policy. It is not the only one. In fact, governments, national and city governments, are already adopting progressive legislation. We at the Global Commission on Drug Policy will redouble our efforts to support societies around the world to positively recalibrate drug policy. We have another opportunity to right the wrongs of global drug policy in 2019. Between now and then, all UN member states will need to start bridging the gap between the international drug control conventions and the many changes occurring on the ground. The tension between the two is reaching a breaking point. In the meantime, we call on the UN Secretary-General to take some steps to move the agenda forward. For example, an urgent priority for the UN is to align drug policy with the new Sustainable Development Goals in the lead-up to 2019. The Global Commission urges governments and civil societies to continue exploring progressive approaches to drug policy and to adopt reforms that are tailored to local needs and rights. Building on the modest steps taken at UNGASS, the Commission encourages and supports societies around the world in their practical efforts to fundamentally realign drug policy so that people's health, citizen safety, and human rights are front and center. Thank you.
Okay. Thank you, Richard. When the commission was created, most of the people who joined it were former presidents and prime ministers, but a couple were actually in office at the time and boldly joined this. One was George Papandreou, who could not be here today, who was the prime minister of Greece at the time. The other was Michel Kazachkin, who joined the commission while he was directing the Global Fund to fight AIDS, tuberculosis, and malaria. Michel?
Thank you, and good morning, everyone. Thank you for attending this press conference. From the very beginning and from our very first report, the Global Commission has been saying that the negative impact of law enforcement policies on the health of individuals and on public health is one of the most devastating legacies of pursuing prohibition. And let me go quickly through some of that negative impact on health. First, violence. WHO highlights numerous forms of violence as actually a health issue. Mexico, Central America, and Latin America have borne, as you would know, an enormous burden of drug-related violence and deaths. HIV/AIDS. Close to 2 million people who inject drugs worldwide live with HIV, and 2/3 of the people who inject drugs are infected with hepatitis C. Eastern Europe, Central Asia, East Asia are particularly affected, but sub-Saharan Africa is now increasingly affected as well. People who inject drugs are also at high risk of contracting TB and multi-drug-resistant tuberculosis, and particularly in the context of over-incarceration that drug prohibition and law enforcement have generated across the world. In general, prisons and pre-detention facilities are, in fact, high-risk environments for infectious disease transmission. They're also, as we have noted in a number of our reports, they're also, in fact, disproportionately affecting women and racial minorities. Another aspect of health violation is that drug law, policy, and law enforcement practices remain in many places barriers to the provision of and for access to the use of harm reduction services and other prevention services. And that is also true for access to licit controlled medicines. 80% of the people in the world live in countries with no or hardly any access to controlled medicines for the management of severe pain. And WHO has explicitly highlighted the role of drug control policies as a barrier to access to licit controlled medicines. All of these impacts, which I have briefly listed, are not, you will note, impact of drugs, but in fact in negative impacts of the way our societies and our governments deal with drugs. That is an impact of drug policies. So at the end, while we acknowledge some good language on access to controlled medicines in the outcome document of the UNGASS, as Richard said, and as we say in our public statement, the outcome document and the UNGASS fail in many respects. To me, it fails calling harm reduction harm reduction. 30 years after it's been shown to be so hugely effective in preventing HIV and other bloodborne infections, it fails to call on the fundamental shift that we need of drug policies from prohibition and law enforcement to policies that would prioritize health over criminal justice approaches.
Okay, thank you, Michel. One of the people who joined the commission a little after it had been created was the former Supreme Court Justice from Canada, Louise Arbour, who has also served in other juridical capacities around the world. Louise?
Thank you. Thank you. Thank you very much. I think another way of looking at the disconnect between the UNGASS outcome document and realities on the ground is to look at what's happening in Canada. Canada has a government that was elected about 6 months ago on a platform which included very overtly the legalization of marijuana. The Canadian Minister of Health spoke at UNGASS yesterday, and I read in the newspaper this morning that the Canadian government is now is unfolding its plan to move forward with this particular initiative. Now, this, in many parts of the world, is still highly controversial. In other parts of the world, it is moving, in our view, in the right direction. But let's be very clear. This is tackling only a small portion of the kinds of initiatives that have to be put in place. This is talking about legalization or decriminalization of the possession and use of marijuana. What the Global Commission is calling for seems considerably more radical, but in fact, it's all part of the necessary steps to enact the reforms that Michel in particular has been talking about, which is the decriminalization of possession for personal use of all drugs. And when it's put that way, it may seem to be very radical. The reality, I think, is very different. The absolute prohibition on the use of all drugs or drugs that are under the current schedule, which is very extensive under the narcotic conventions, I think it's pretty clear has been proven hugely ineffective in even meeting its own objectives, which is not only a drug-free world, but a substantial reduction on the consumption of drugs. So it has failed. If that was the only consequence, we could tolerate these kinds of policies just as a waste of time, essentially. The reality is that there are enormous costs associated with these failed policies, not just financial cost in human lives, and, of course, the tremendous cost of having created this criminal black market. So I think when all that is put in place, one has to pause and look at what the alternatives are. And the alternatives have to begin with the decriminalization of the use of all drugs. If that sounds like a radical proposition, I would suggest to you that, in fact, if we took a step back from the 50 years or so of repression to which we are now addicted, and if we started from scratch developing a proper policy for the control, the marketing, the use, the consumption of three somewhat similar products, alcohol, tobacco, and drugs, it would seem to me that the suggestion of the absolute prohibition of one of these products would seem like the most radical and surreal suggestions. These three products are in demand. They've always been in demand. A limited demand, but a steady demand that we've never been able to eradicate. Their benefits, in some cases, are almost non-existent. In other cases, they may have marginal benefits. Their level of harm varies, in some cases going to extremely harmful consequences, such as addiction and, in some cases, death. The schemes that have been put in place historically to control these three types of substances are very radically different, going from, in the case of alcohol, in most places, regulatory scheme. In the case of tobacco, for decades, an absurd policy of active promotion of consumption, which proved catastrophically bad for public health and so on. And in the case of drugs, absolute prohibition. We now know from this experience that these two policies, the full-fledged market publicity of the consumption of tobacco and the absolute prohibition of the use of drugs, have both been very misguided policies. The one in the middle, a balanced approach to market regulation, control of production and distribution, obviously is the one that needs to go forward. What is currently preventing us, I think, as I said, is the addiction to a failed policy for which our leaders have been unable or unwilling to provide adequate alternatives. And unfortunately, the missed opportunity of this UN General Assembly session is another occasion where we've been unable to move forward. What's encouraging, I think, is the language that has been used by many who participated, both civil society and government leaders in UNGASS, and the initiatives that are starting to take place in many parts of the world, including in Canada, in taking some steps in the right direction. Thank you.
Okay, Louise, thank you. Some of you may be aware that before the Global Commission on Drug Policy was created in 2010, there was another Drug Policy Commission, the Latin American Commission on Drugs and Democracy, created about 2 years earlier. And that was the brainchild of three former presidents. One was Fernando Henrique Cardoso from Brazil, who unfortunately could not be here today because of the craziness going on in his country. The second was Cesar Gaviria, who is on this panel today and who's the former president of Colombia and former Secretary General of the OAS. And the third, who will speak now, is Ernesto Zedillo, the former president of Mexico.
Thank you, Ethan. Richard Branson already mentioned that one of the frustrating shortcomings of the UNGASS declaration is that no reference is made to the question of regulation. As my colleague Luis Arbor explained, our Global Commission is all in favor of decriminalizing the use of all drugs. That is to say, people should not be put in jail for consuming drugs. There should be an effort on prevention, certainly, as we have never had it, by the way. But once you establish this idea, which I think is a very sound, humane idea of not criminalizing the use of drugs, you cannot avoid talking about supply. Because some people say, okay, I agree with decriminalizing consumption, but I'm not willing to discuss how people are going to provide themselves drugs. And that immediately leads to a very serious problem. Because if states decriminalize consumption but don't want to address the issue of provision or supply, simply are abdicating of the responsibility to regulate a product that has to be regulated. Because by definition, somebody, even if you say it is prohibited to supply drugs, somebody will be willing to violate that law because there is a profit incentive, and the state will be providing a big business for criminal organizations. And that is what historically has happened. And this is terrible, right? Because this is a big business that feeds the worst criminals in the world, and this is a business that has been engineered by state policy. This is an example of sophisticated state failure. And that is why we have insisted that governments, societies, organizations should debate not only the question of decriminalized consumption, but also how to regulate the provision of drugs. And we propose that, and we have been insisting on that, not because we happen to believe that drugs or all drugs are harmless. No, precisely because some drugs can be very harmful, it is that states have the responsibility of regulating drugs and not leaving the provision of drugs in criminal hands. And that's why we stress this point, and that's why we believe it was a disappointment that this issue was not part of the outcome document of UNGASS.
Okay, thank you very much. So at this point, we decided to keep the initial statement shorter so not all the commissioners had a chance to speak. I will make an effort to direct questions to those who did not have a chance to speak as yet. I also want to welcome not just the people in this room, but because this press conference is streaming, we have reporters listening in who will not be able to ask questions, but are listening to what's said here. So we'll begin now the question and answer, and please just raise your hand, and you can ask who you would like to direct your question to, but I may also redirect. So go ahead. Yes, in the front here. And please speak up so they can hear you in the back.
With microphone, please.
Curtis Ellis with WorldNet Daily. Thank you all. Mr. Volker, I think this question would be appropriate for you, since there is all this talk about the corrupting influence of the current policies, and as Mr. Branson pointed to, with money laundering and the Panama Papers, could you address the corrupting influence of the money on banks? And can we dismiss that perhaps the banks are profiting from the current policies and resisting the kind of reforms that the Commission is advocating?
Well, I'm not aware that American banks, anyway, are resisting reforms in this area. They got problems. They got problems in many areas with money laundering, and the money laundering regime, anti-money laundering regime, is obviously a lot stronger now than it was some years ago. I don't know the extent to which it's directed actually toward drugs, but the basic point you make, which I am very much in agreement with, is the problem with the present policies are they don't work, and it leads to a corrupting influence on a lot of people, a lot of governments, unfortunately. And apart from the health reasons, the human values, and all the rest, it is a serious problem in Latin America in particular, but other governments, which is why I'm sitting here in this rather unfamiliar territory of central bankers like to stay away from presidents and politicians. But this is I think a serious effort, which is a serious point, and it is disappointing. I've had other experience with the UN, but getting the UN to move is a challenge, I'll tell you, when the ownership, membership that it has. But attitudes are changing in the public. They're obviously changing in the United States. And I don't feel very radical about this in the sense that Ernesto was just making the point of the need for regulation, which I think is relevant. You know, this little story I told Ethan, and he impressed him. I was making a talk to a group this size, which was not a young group, a couple of years ago, and I was making my little pitch for marijuana decriminalization. So we don't want to go too far. That doesn't mean we don't need some regulation, and we don't want it sold in schools or permitted in schools and put in cookies and all that stuff. And I got all finished, and this rather elderly, gray-haired woman charged up to see me. She said, "Mr. Volker, I don't agree with a word that you said." I thought, uh-oh, she's not in favor of decriminalization. She said, "I come from Humboldt County, California. We grow the best marijuana in the world, and we don't want the government messing around with how you regulate it." So it was rather a sign of changing attitudes.
On the point of the banks, Colorado has legalized the use of marijuana, and your experience and expertise in the financial area. What they've done, though, is none of these legal vendors are allowed to access the banking system. So it's a cash business. They've got safes full of $20 bills or whatnot. They're not allowed to open bank accounts. Would you care to talk about, because this actually falls into the realm of regulation?
No, but I'm not familiar with the situation there. I got other things to worry. I got other things to worry about in the banking system, but I will ask a few questions about this.
Yeah, it's worth saying about that issue that at an event last summer when Governor Hickenlooper, the governor of Colorado, was asked, what's the single most important thing that needs to happen now to keep this process moving forward in the right way, his response was the federal government needs to fix this problem whereby the marijuana industry cannot engage in banking with federally regulated banks. So there are bills in Congress to address that. There are efforts. The Obama administration, Treasury Department has made some efforts in that regard, but it sounds like it will require federal legislation.
But Ethan, I think it's worthwhile stressing a point. This is a wonderful example of the contradiction that exists between laws that are under the umbrella of the 3 international conventions, and that is the case of the federal law of the United States, and that affects, of course, banking laws, and what is happening on the ground. Because here you have a state that is pursuing an enlightened policy, I believe, the state of Colorado, but then they are encountering these problems that are derived from the fact that the U.S. federal government, which, by the way, was great promoter of those 3 international conventions, cannot really do much because then it will be in violation of international law. And I think that contradiction is what we stress, and Richard did it also in its comments. That contradiction has to be solved, and not in favor of the conventions, by the way.
Just to make the point also, that as the U.S. moves forward on the legal regulation of marijuana, other countries are beginning to discuss this as well. One of those countries is the Czech Republic. And so Pavel Bem, sitting at the end, was previously the drug czar of the Czech Republic, the mayor of Prague, a national political figure in the Czech Republic. Pavel, do you want to comment on this at all?
Thank you very much, Ethan. Good morning. I think it's useful sometimes to make a step down from the global perspective and UN conventions and international drug control system to a local level, to practical implications of global drug policies and punitive and repressive prohibitory regimes in a practical sense. So sometimes, or very often, we see that even though the national governments and national drug policies are extremely prohibitory and extremely punitive, and as we know that the drug problem is very often concentrated in large cities and metropolitan urban areas, we see extremely important role of local decision makers and city mayors, for example, who even in drug policy regimes with the prohibitory mainstream could make really big changes. So we guess that much more attention has to be also paid to the local drug city policies or regimes, which can in fact at the end be the only advocates, together with non-governmental sector, of drug policy reforms or public health and harm reduction services like needle exchange schemes, for example, or consumption rooms. And we see that even in countries like the United States.
Okay, thank you. Other questions? Yes, right here.
Hello, thank you for your time. Jessica Glenza with The Guardian. I wonder what your opinion is about the UN's use of drug abuse in terms of drug use. In other words, they equate all drug use with drug abuse. And I wonder if you could talk a little bit about that, and also if you could talk a bit about how you might consider regulating very dangerous substances, for example, cocaine or heroin, in this regulatory scheme that you're proposing.
So if I could just suggest that the two people have not spoken as yet, that Nick Clegg and Cesar Gaviria start off by answering this question.
Well, look, I mean, firstly, I think the generic problem, it's specific to the question you ask about sort of UN terminology, but the generic problem for the UN system is that it's looking increasingly divorced from reality. And the danger is that in the next 3 years that only gets worse. As so many fellow commissioners have said, we're at a tipping point where regulation, at least of marijuana, is now happening on an ever greater scale. And when Canada moves forward with regulation, you've got these states in the United States. California has its plebiscite in November. Mexico, President Peña Nieto indicated that maybe Mexico might follow the example of Uruguay eventually. So you could be in a situation where you have a regulated market for marijuana stretching from the Arctic to the equator, and yet the UN system doesn't even mention it. I mean, it doesn't even refer to that reality. And so you ask about UN terminology of abuse or use. I think the problem is more profound than that. It's because of this gridlock that we've seen here at UNGASS this week. This distance now between a gridlocked UN system and an increasingly innovative reality across the world, particularly here in the Americas, I think is placing increasingly intolerable strains on the credibility of the UN system. And look, onto your question about throwing our imaginations way into the future about a sort of fully regulated market. I mean, as Louise has quite rightly said, for the drugs, non-marijuana drugs, if I can put it like that, our emphasis as a commission is on decriminalisation across the piece. Marijuana is consumed in such large scale that remains our principal focus in terms of the initial regulatory step. That's our journey, but as I say, even that journey, which, as I think Paul Volcker quite rightly said, is not, in my view, hugely radical, is already so far removed from the UN system's own perception of things, which is increasingly looking out of touch with what's going on the ground.
Yeah. Ethan, could I?
Just a brief answer, perhaps, to your question. I mean, a very clear one. It is for us obvious, and it is obvious also for the scientific community and all those who have experienced the relationship with people who consume drugs, that the largest majority of users of these substances are not dependent, do not need a medical help. And this is a shift that is important also, I think, we made in the Global Commission, and I made as a health minister in Switzerland for 10 years and more, and that is that medicalization of the problem is not the sufficient answer. Because, yes, there are some medical needs, there are some public health aspects that have to be considered and take priority in a medical approach. But all the people who consume drugs, 90% of the people who consume drugs are not medical cases. there are free people who choose to enlarge their consciousness. There are people who try to have some fun or to perhaps also to cure some bad feelings they have, but they are not people who are in need of a medical support.
Yeah. Louise and then Cesar.
Yeah, I just want to add one thing. First, I think the UN Office of Drugs and Crime, UNODC, has always taken the position, looking at the consumption worldwide, that there's about 10 to 15% of drug use that qualifies as what they call problematic drug use, so drug abuse. So the prohibition is to prohibit the large majority of non-problematic drug use in order to prevent that. As to your question about regulating very dangerous substances like heroin, we have a regulated drug market already. It's called a pharmaceutical market. And you know what? It's not perfect. We've seen all kinds of prescription abuse. There's enormous abuse of prescription drugs. But we have some experiences there about proper qualification, production, control of distribution of very dangerous substances. As I said, it's not a perfect system, and we need to be very attentive to it, but they are professionals that are responsible for its application. So I don't think we should panic at the idea that there are some very dangerous substances that could not fall under a regulatory scheme.
Yeah. May I just add also that Switzerland has a medical prescription of heroin, for instance, and that is an answer to this problem, and it really allows more than 1,000 people to have a normal life with a medicine that is given by and prescribed by medical personnel and taken in day clinics.
Yeah, Cesar. And take the microphone, please.
Yes, I think for the Office of Drug and Crime and the board, it's very difficult to distinguish between use and abuse, because they have an objective that is totally unrealistic, totally naive, I would say almost stupid, that we are going to live in a in a world free of drugs, which will never happen, which is not happening. The policy that totally failed through 5 decades, but they don't care. They insist that this fighting against drugs, this war, is what is going to work, and that we are going to live in it. So they don't care about use and abuse. They cannot make the distinction. They think that if there is some use of drugs, that is not misuse, that is breaking the promise they have made the whole world, that we are going to live in a world free of drugs. And a stupid thing, because it's totally stupid and unreachable.
Next question in the back there.
Hi, I'm Georges Lachaze from the French NGO ASUD. There's a large part dedicated to the evidence-based in the document, and we all agreed we need evidence-based. But as a self-support group of drug users, we are concerned that if it's not well used, it can turn out to disqualify the expertise of drug user. And you pointed out the need of more implication of the civil society. And as representative of civil society, as drug users and NGOs, what can you think about this topic?
Who would like to take that?
Well, if your question is whether we should and policies should associate people who use drugs in their design, the answer is, of course, yes. As some of my colleagues said, and Ruth in her introduction, we at the Commission value enormously the contribution of the civil society, and within the society, the civil society of the community of people who use drugs. So we do listen very carefully, and we do value enormously your input.
Next question. Yes, right over here.
Hi, I'm Nilu Tabrizi from Vice News. So I'm just curious how you're going to get different nations to buy into decriminalizing all drugs for personal use, because it's really important. I've spoken to drug users who don't want to call paramedics onto a scene of an overdose because they're scared they're going to get arrested for having drug paraphernalia. So how do you get people to buy into this really important idea?
Let's start with Richard Branson.
Well, we've done a global survey on this, and interestingly, if you ask the question, do you think drugs should be treated as a health problem rather than a criminal problem, all drugs, you get something like 93% of people who say yes, they should be. I mean, if my children have a drug problem, or if my brothers and sisters have a drug problem, I'd expect them to get help, not put in prison. And then if you point out countries that have actually decriminalized all drugs, like Portugal, and you see the wonderful beneficial effects that have taken place in Portugal, the massive reduction in heroin use and other drugs. That's another way we find of persuading countries that it makes sense for them to try it in their own country. We know, the Commission still exists, sadly, after 6 or 7 years, and we know there's still a lot of work to do. But I think that, the more you can point at examples where it's worked, the easier it is.
Yeah. Nick, or anybody else?
Just on the back of what Richard said, in the UK, where the debate is just stuck, and the government as a whole is just sticking its head in the sands, we've just had a record number of drug-related deaths. Record number. About 3,500 in I think, year 14-15 or 13-14. The equivalent number in Portugal, okay, it's a smaller country, but still is 22. I mean, what other statistics do you need to prove the point that the kind of boneheaded approach is bad for the health of your citizens? You're letting down, if your record number of people are dying, and you have a decriminalisation approach, as Richard has explained, very nearby, which has such a dramatically different outcome, lower numbers of drug-related deaths. Any rational politician or decision maker or politician should listen to that.
Cesar?
Oh yes, yes.
Just use the microphone.
We have here 2 problems. One, only 17% of the world population has access to morphine. Only 17%. 83% have no access at all because of the controls of the UN system, because that is true. The controls are so strict, but out of that, you can get illegal heroin in the streets of New York. So the system guarantees that no one has 80% of the world population do not have access to morphine. But it doesn't matter as a medicine. But it doesn't matter if the streets are full of illegal heroin. And that is a nonsense. So what we need is a real effort to put the control of drugs in the hands of states and government agencies and civil society. And the other thing that is unbelievable is the 3 conventions that were negotiated 50 years ago when no one knew anything about drugs, and we have 50 years of experience, pretend that is more important than the other conventions of the UN, that the UN Rights Convention, that the World Health Organization, and that are more important than national constitutions, than national law, than national experiences. No one of those can be accepted. The only thing is prohibition, repression, and thousands of killings. Drug policy is generating a lot of more people that, as it happens in Great Britain, than what drugs harm, the harm that drugs do. I mean, you have a lot more killings and no more people killed because of drug policy than because of drugs. Mm-hmm. That is the policy we have in place.
Okay, thank you. And Pavel?
Is the public health benefits of the decriminalization is just clear. Czech Republic has decriminalized the use of drugs similarly as Portugal. And when we look at the HIV prevalence among injecting drug users in the Czech Republic, it's one of the lowest rates in Europe. If you look at the overall mortality and overdoses, for example, again, one of the lowest rates in Europe. So there is an imperative for drug policy and decision makers just to make the reform, because it simply saves not only lives, but at the end also money.
Okay, thank you. Over there? Did you have... No? Okay. Yeah, there you go. There's a microphone.
My name is Robert Husbands. I'm with the Office of the United Nations High Commissioner for Human Rights. In part, my question has already been addressed, but Richard Branson and Nick Clegg both referred to the case of Portugal, where they have a very successful decriminalization of all drugs. And they've had it since 2001. It's 15 years. And so my question to you, in your opinion, what are the obstacles to these policies being emulated in other countries? Is it a question of advocacy? Is it a question of communication? Is it a political question at the national level? Because it strikes me that the obstacles, first and foremost, actually are at the national level. So that's my question to you.
Thank you. Yes, Ruth.
I just want to say, and it's also an answer to a previous question, that we will put our priority in the next months on advocating for decriminalization and bringing these examples also to other countries and urging countries to make steps in this direction. When we speak about decriminalization, it is going beyond what is the case of Portugal and the case of the Czech Republic, because we think there is no reason to say that consuming drug is a crime. We are not looking for alternative to punishment, which is the case of Portugal. We are looking for a decriminalization in the sense that there is no line in the penal code, in the criminal code, that says that consumption of drugs is a crime. This is our aim, but we have to show the experience made in countries who made a step in this direction to show that it helps all the other measures. If we have in a country, for instance, harm reduction services, but on the other side, you know that it is a crime. It is a crime, for instance, and you can be punished if you call for an emergency service because your friend is on an overdose, and you are obliged to go to the police because you are accomplice of this consumption. These are the incoherences of the system, and we have to fight against these incoherences. Yeah. This is the reason why we are for decriminalization, because you cannot go to the end of what we aim in health policy if you maintain the criminalization of the use.
So hold on a second. So because there are now all of a sudden a bunch of what we'll do, we will end in 15 minutes. What I want to do is to take 4 quick questions in a row and then hand these over to the audience to choose. So let me go to you first. Yes, right. What? Right there.
Thank you.
Yeah,
and please make the questions quick.
Okay, very quick. Diego Senior from W Radio in Colombia. We've heard policies in Switzerland and in Portugal for advancing on heroin, I heard, but our colleague here asked about substances like cocaine, particularly coming from our country and all the issues that we have. So any policies or suggestions focused on that substance in particular coming from the Commission?
On cocaine. Okay, and then the second question right there in the second row.
Hi, I'm Rachel Wright.
Yeah.
Rachel Wright from the BBC. You say you're disappointed in the declaration from this UNGASS and it's out of touch with reality on the ground. So what do you think governments should do in the 3 years before the next drug summit to get back in touch?
Okay, third question, the front row right here.
Thank you. Mauricio Guerrero from Notimex, Mexican news agency. Could you comment on this idea that drug policies has been used basically as a tool of social control? And in your experience as leaders, how is this true? How true? There was an interview with a former official of the Nixon administration, and he mentioned that Nixon started the so-called war on drugs because he disliked African Americans and hippies, according to this interview. So it was just basically as a tool of social control. In your experience, is that the case, or how much that is the case? Thank you.
And the fourth question also here.
Hi, Will Gold.
Fine.
Will Godfrey of theinfluence.org. Given all that we've heard, would you say it's fair to say that the current drug regime is a significant driver of the inequalities between the developing and developed world? And I wondered if you could speak more to that.
Okay, so we have four questions. One about cocaine and all of this. The second about the next 3 years leading up to the next UNGASS session. The third about whether drug control is really about social control. And the fourth. So let's, Cesar, I'll give you the first chance. And use the microphone.
Yes. Yes. One thing is about cocaine. There has been a small reduction of consumption of cocaine in the U.S. because it has been replaced by methamphetamines and now by heroin. But one thing we should know, and we have very clear recently, in Colombia, even with all the efforts of Plan Colombia, even with the situation that Colombia has the largest army in America, the largest police in America, the second military spending in America, 6% of the GDP in security, 95% of the cocaine that is seized in the U.S. comes from Colombia, which means that extraordinary effort has been done exclusively to improve security in Colombia, has not stopped at all the flow of drugs to Colombia. That means that those military means of trying to stop the flow of drugs totally fail, as have failed the ones in Mexico. Because if you look how the amount of drugs that is coming from Mexico in their different kinds, you easily get to that situation. So there is no way to solve those problems using those military means that the Commission defends so aggressively. And second, Uruguay has received all kinds of criticism from the UN bodies because of the changes they made courageously. The US states, none. And the US delegation is the responsible, we don't have a better declaration. They have said all the time that because the Chinese do not agree, that because the Russians don't agree, because the Iranians don't agree, because the Pakistanis don't agree, it's impossible to change drug policy. And the country that needs more language to justify the big changes that in this country are happening is the US. But the US delegation opposed any change because the Russians don't agree, the Chinese don't agree, the Iranians don't agree. I mean, if the US policy is that, we will never have a change of drug policy. Just it will come down all these conventions and all that because of the totally lack of pragmatism of the U.S. government and the U.S. delegation.
Okay, thank you. Others on the panel to respond to these four questions.
Can I take your question?
Yeah, and use the microphone or something.
Control. Well, I don't know. It's hard to say what was in the mind of, whether it was in the mind of politicians to use these policies as means of social control. But what we do know, and this is a fact that it's very clear in the statistics, is that the enforcement of drug policy has proven to be definitely socially discriminatory, particularly in this country, right? Because if you see what percentage of the population, for example, is African American, which I think is 14%, and if you check what is the proportion of people, African American people that are in jail for drug offenses, is more than 50%. So enforcement has clearly had a consequence that it's socially discriminatory. Now, if you go back in history, I think your thesis has some support. In a little book that was promoted by Richard Branson, this book, and he asked me to write an article. In a few pages, I tried to recover the history of drug policy in the United States as done by a great scholar at my university, David Musto. So I wrote 4 pages about that. And from every step since the early 20th century, There is evidence that in these steps there was a social group very much in mind. When there was the question of opium, was the Chinese. When there was the question of cocaine, were African Americans in the South. When it was marijuana, was the Mexicans, of course, and so on and so forth. So yes, there is some presumption, but I don't care about what was in the origin. I care what it is today, and today these policies are socially discriminatory.
Nick Clegg?
Just in reply to Rachel's question, what should governments do? I mean, it might sound trite, but actually the most important thing of all is that governments have to acknowledge the scale of the present failure. If you don't, you can't. It's like any other walk of life. You can't come up with solutions unless you're first honest about the scale of the problem. And at the moment, the whole system is in denial. It's not even recognising the scale of the failure. And you know, many fellow commissioners have talked about how wrong-headed it is to criminalise people for drug possession or for personal use. The great irony is we're criminalising people for that while allowing the real criminals to get away scot-free. We have a major public health problem on our hands because drugs are bad for you. Some are not so bad, some are much worse, but they're bad for you. Since when was industrial-scale criminality the answer to a public health crisis? Why is it that in the country I know best, the UK, 60,000 largely young people per year get a criminal record for drug possession, and yet the transborder criminal industry, which sells them this stuff, is barely touched. That is the scale of the sort of irrational failure that is going on now. I would go as far as to say that the governments that refuse to confront this, and they might do so because they think it's politically difficult to do so, are aiding and abetting criminality. And they've got to be honest with themselves, but that is the consequences of their inaction. And I think that would be the most important step between now and 2019, because you're not going to get any movement unless there's greater candour about the scale of the problem in the first place.
Louise?
Yeah. Although I can't vouch for the accuracy of what I'm about to recount, but I have heard it said that the original classification of cannabis as a narcotic in Canada, I've read that this had been at the instigation of the American cotton industry that was concerned about the growing of hemp and not the THC content of cannabis, because Canada could have become a competitor to the production of cotton in the U.S. by the production of hemp. There are all kinds of conspiracy theories about the origin of these products. The reality, I think, as Ernesto said, is that there is no doubt, and it's not just in the United States, that the application of the current prohibition are hugely discriminatory. In Canada, I think the disproportion of Aboriginal people incarcerated, including for drug use, women on charges of trafficking, serving very long sentences. I just want to make one small point on the question of what should government do, because this goes to the more than disappointing failure of UNGASS. By reaffirming the framework of the convention, to which virtually all states have subscribed, the United Nations has now confirmed the inability for innovation and experimentation with alternatives to prohibition. So countries are committed to staying with some maybe harm reduction treatment models, but staying within the requirement of a repressive model. In our press statement, we have acknowledged that they are experimentation, such as legalization of marijuana, and we've said these approaches should be encouraged despite the restrictive language of the UN conventions. Now, this is a pretty sobering statement for people like me who've worked within legal systems. This calls for, and it puts government, again, in democratic societies, governments committed to the rule of law, in the untenable position of having to either repudiate their participation in an international convention, so denounce the convention. It's a very bold step, and it could encourage others to walk away from international commitments on other issues, or to pretend that they're in compliance when they know full well that they're not, or to simply be in, quote, principled non-compliance. All this is very bad for the rule of law internationally, but it's the reality which We feel we should continue to promote innovation and experimentation in the hope that in 2019, as Nick said, the acknowledgement of the size of the problem will have been put in place, and we will have better sources of empirical evidence that alternatives actually are much better.
Okay, and so Michel told me that Louis' answer has made the comment he was. Paul, did you want to make any last comment, or are you good? Good. Okay, well, with that, what I want to do is turn this over for some closing comments by the incoming chairman of the Global Commission, Ruth Dreyfus.
Thank you so much. But first, I would like to answer the question on cocaine. I think we, at this point, we don't have really what we have for heroin, the way to find how to help people who are in difficulty to have a reasonable consumption of cocaine. But we know that many people have this reasonable consumption. I mean, we know that cocaine is used in a controlled way by many professionals who are on the better side, on the sunny side of society, without having the problem of the people who are in the street and who are chasing for this substance. Now, for 19, I would say what is important, and the Global Commission is committed to that, is to have a more inclusive process, that the process who have led to the UNGASS 16. More inclusive means more inclusive for science, more inclusive for the civil society, but also more inclusive for other agencies of the UN. And I think it's one of our proud that we could also help UNDP, WHO, the High Commissioner on Human Rights to be very vocal and to bring their point of view, which is a point of view that is absolutely key if you address the problem of the drugs. And on developing countries, this divide, yes, is a great one, and this is also speaking for regulation, because as it is said by one of my colleagues, you cannot just speak about decriminalization of consumption and not know from where the substances are coming, who is growing the plant, who is making the substances that are consumed. So it is clear that the criminalization of consumption is also a criminalization for the people who are on the other side of the chain. So that this will also be one of our priority, to look at the criminalization of the people of the criminal chain, if they are on the low level, on non-violent level, shouldn't be punished, or they should be in the country supported. Now you have seen we are critical for we are analyzing in a critical way the policy as it is. We continue to push for progress that are in the frame of the convention, but not really implemented in a large scale, which is necessary. We are advocating at all levels for harm reduction, for alternative treatments, for proportionality of pain, all these little steps that can be done without difficulty in the frame of the convention, because they are important, because we are pragmatic, because our aim is to save life. Our aim is also to help people to have a balanced life and to be socially integrated. We are not here on an ideological trip. We are on the search of practical solution that works. And in this sense, we will continue to support countries, to support cities, to support, to be a bridge also between the NGOs and the government, because we have the possibility to open doors because of our former responsibilities, and this is very important. But more important than that, perhaps, or as important than that, is to fight for a new coherence of the policy. And this new coherence can only be realized if we are not only looking at the health aspect, but also the aspect of decriminalization and the aspect of regulation. All these elements are interlinked, and this is the reason why we have proposed these 5 pathways for drug policies that works. And we will continue this fight, and we thank you for supporting it or for also giving us the possibility to have our voice better listened and understood in the world. Thank you for the media representative, and thank you for our friend from the NGOs who are here.
And so let me just say to Ruth Dreyfus, Richard Branson, Michelle Kazachkin, Louise Arbour, Nestor Zedillo, Pablo Bem, Cesar Gaviria, Paul Volcker, Nick Clegg, and the other half of the commissioners who could not be here today. Thank you for your time and for your commitment, and really, as Ruth just said, for providing both a bold vision about where drug policy needs to go, as well as a commitment to the incrementalist process that inevitably happens in the United Nations. Thank you all for being here, and have a good rest of the day.